Good afternoon, everyone, and welcome to the COVID 2.0 and updated health literacy echo for medical providers, brought to you by Health Confianza, a collaboration between the UT Health San Antonio and the San Antonio Metropolitan Health District. Please note that we are recording this session so we can share it later, but your name and the comments in the chat will not be appearing in the recording. My name is Raquel Romero. I am a physician by training, and I'm going to be the facilitator for the echo session today. We have a lot of information to cover, but before we begin, I would like to ask our UT Echo IT person, Carly, to provide some directions for us. Carly, in your time.
Hi, please stay muted unless you're speaking. You can use *6 on your phone if you called in, or the microphone icon on the bottom left of your screen if you join it on a computer. You can also communicate with the chat feature. If you're having issues with your connection, please privately chat with me, UT Echo IT. Thank you.
Thank you very much, Carly. You can also add your comments and your suggestions in the chat box, or you can, if you have problems with the connection or with the audio, you can send a private message to the UT Echo IT. I would like to mention that to view the closed captioning for this session, please navigate to the bottom of the Zoom window and select the show caption option. And you may need to click more in the bottom right of the Zoom session so you can find the menu. If you have some problems with the connection, you can also send the question to the Echo IT. There is a large group today, and I would like to ask if you please, for attendance records, you can put, you can add your name, your title, the organization in the chat box. So that's going to be for our attendance records. I would like to go ahead and do the introduction for our Confianza team, and we have Dr. Rosenfield.
Hi, good afternoon, everyone. I'm Jason Rosenfeld. I'm assistant professor in the Department of Medicine at UT Health San Antonio, and I'm also the implementing director for Health Confianza. It's wonderful to be with you all today. I'll be serving as the facilitator in lieu of Dr. Bergeron, who sends her apologies and best wishes, but was not able to make it today.
Thank you so much, Dr. Rosenfield, going to be the lead specialist for our session. We have Dr. Houston, didactics presenter.
Hi there, happy to be here today. I'll introduce myself a little bit more once we get to the didactic portion.
Thank you so much. And we have a case presenter, Dr. Prasad.
Good afternoon. I am a behavioral health consultant for the GME, and my work is basically with residents, fellows, and some faculty. And I'm so glad to be here, a part of this. And my, incidentally, my MBA in healthcare was from Our Lady of the Lake. And when I saw Dr. Houston's resume, I said, hey, there's someone from his school. So very welcome, looking forward to be here.
Thank you very much. And then we have panelists, Dr. Prasad and Dr. Higgins.
Hi, I'm Jessie Higgins. I'm the Chief Mental Health Officer for the City of San Antonio. Thank you for including me today.
Thank you very much. As a quick reminder, please complete a pre-echo survey that you receive when you register for the echo sessions. And toward the end of the session, you want to also find a link for an evaluation. Please take a moment. Your feedback is so important, and these sessions are possible because of you, your participation, and because of your support. You also want to see the information about the continuing education credits in the chat, and the activity for today is 10092-348. Next, we're going to have didactics and the impact of the COVID-19 and psychological health of the healthcare providers. And then following up, we have a case scenarios. These case scenarios is very important. I would like to ask you, if you have a case to present, please reach out to us. The information also is going to be in the chat box. And remember, ECHO is all teach, all learn environment, and I'm encourage you and invite you to put your comments in the chat. Thank you so much. With no more from my date, I would like to go ahead and do the didactics, the space for Dr. Houston. Dr. Houston, on your time.
All right, just give me a moment as I share my screen. And we can get our presentation going. All right, can everyone see the screen and the presentation? Perfect, perfect. All right, as mentioned before, my name is Dr. Brittany Houston, and I'm excited to talk with you all today about the COVID-19 impact on psychological health of healthcare workers. I'm currently at UT Austin. I'm an assistant professor in the population health department. I also serve as the behavioral science director of the family medicine residency program, where I see patients in a local FQHC up there and also teach our residents how to do brief behavioral interventions as well as focus on their own wellness. I want to recognize today that often a lot of us are over our lunch hour right now. So thank you for taking your own personal wellness time to attend this talk. And I hope that either today you get reconnected with something that brings your self-wellness, you learn something new that brings you closer to what's important to you, or you figure out something else that would be helpful in these difficult times. What I'm hoping that you will learn after this presentation is to be able to identify the psychological stressors and impact of a pandemic, to discuss COVID-19's impact on the psychological health of the general population and healthcare workers, to understand when it's time to seek treatment, and to recognize the ethical responsibility of self-care across healthcare professional disciplines. Additionally, we're going to go over some individual and organizational strategies for resilience and intervention. If you could, you've already put your name in the chat and your role of organization, but as a way to facilitate our conversation later on in the Q&A and the panel, please list one thing that you would like to learn from today's presentation. That way, if we don't address it in the presentation, we can go ahead and incorporate it later. Just give you a moment to do that. All right. So the first thing I want to talk about is not specifically about COVID-19, but talking about pandemics across the historical course. So each pandemic or outbreak has its own characteristics, but we do see that there are common stressors that happen across different pandemics. For example, with the Russian and Spanish flu, we also saw widespread emotional distress across the general population. People were faced with uncertainties, right? When is this going to turn into a pandemic? When is this going to end? What news stories should I be thinking of? How do I keep myself safe? So dealing with that uncertainty, it definitely amplifies some of the stress that the general population can experience. Also, that threat of, to their individual lives, experiencing a trauma themselves, or even their loved ones or people close to them experiencing that trauma. Dealing with grief and loss. So if in the event you do lose someone close to you, grieving the loss of that person, but also different forms of grief, such as grieving the way that your life was before a pandemic, or grieving your health before you might have contracted the virus, or even grieving the loss of a job, or any other things that may have changed as a result of a pandemic. We see that often employment and livelihood is threatened across pandemics, and there may be an increase in emotional distress as well as behavioral health concerns. Particularly for those individuals that have like weddings or family traditions or other things that have been built into the ingrain of their daily or yearly lives, we notice that there's disruptions across that when dealing with the pandemic. Also, we're often exposed to different ways the media are covering the virus or the outbreak, and different ways they're depicting that about how to stay safe and the threats that may be coming across with that. We find ourselves more socially isolated and have a fear of infection. And as our panelists were discussing earlier today, even the stigma around getting infected and sharing that with others around us. And then also the lack of consistent engagement in healthcare and chronic disease management. Now, not every pandemic is riddled with the idea of widespread emotional distress. There seem to be some factors that promote widespread emotional distress, such as the lethality and the likelihood of the contagiousness of the disease or the virus, how media coverage is focusing on the outbreak, if the disease is familiar or novel, how painful or gruesome the disease may be, all impact if there may be an emotional distress, such as that we didn't see an widespread emotional distress with the influenza pandemics in the middle 1900s. So when the psychological distress comes, there are many ways that people tend to cope with this stress. One of those ways may be maladaptive coping, so ways that pull people away from what's important to them, maybe even avoidance strategies, such as substance use or overeating or poor health habits. Other ways that people may adapt or try to adapt to this change in the basic living is adaptive coping skills. And so this is the way that they've been able to integrate this new way of life and still remain close to what's important to them. You can see that in electronically connecting to loved ones and then figuring out a new and consistent routine that can keep them grounded throughout the day. Other psychological reactions may be ineffective or illusory coping skills, and this is an attempt to go ahead and resemble some sense of control. You can see that in panic buying as well as hygiene theater. Hygiene theater is performing an over cleaning or washing of a place in order to feel a sense of more safety, even if it doesn't reduce the risk of you contracting the virus. Other ways of coping may include sorry, I'm having a little bit of difficulty on the next bullet, psychological reactance. And so what psychological reactance is almost an attempt to maintain your own control. So when safety precautions have been placed on us in order to keep safety and reduce the risk of spreading the virus or the disease, people tend to be motivated to almost buck against those requirements in order to maintain a sense of autonomy and freedom. We can see this in anti-masking or people refusing to social distance. Of course, with any type of psychological distressor, we get emotional distress. And this can come in forms of anxiety, depression, boredom, you name it. So if we look particularly at the COVID-19 pandemic, there's one big difference that puts COVID-19 apart from some of the previous pandemics, right? In the early beginning, we're having that 24/7 media and social media coverage, which heightens our awareness and even the stress that we might experience related to the COVID pandemic. But we also have advancements in medical technology to be able to combat that virus. Despite COVID-19 impact on our overall health, behavioral health concerns seems to be amongst the top reported concerns associated with COVID-19. And the psychological impact seems to be greater beyond the medical impact. For example, a study was conducted in the early 2020s of US and Canadian participants during the lockdown. And during that time, they found out that of 6,500 participants, 2% of those participants had contracted COVID-19, but 20% of those participants noted an increase in anxiety and depression. Another psychological impact to consider is for every one person lost to the COVID-19 virus, there is an average of 5 immediate family members that are grieving, and those are just immediate family members. If we continue to focus on just depression and anxiety, the World Health Organization noted a 25% increase in the global prevalence of depression and anxiety in just the first year. Longitudinal studies have shown that depression tends to start, persist, and get worse over time, and anxiety seems to fluctuate and have flare-ups. Those at increased risk for developing a mental health concern during COVID-19 are young people, women, healthcare workers, and those who have pre-existing conditions of mental health and physical health conditions. I want to just pause here, and I'm guessing many of you have saw this meme, so you don't have to guess what's behind the heart. But as people were starting to cancel events and social distance, healthcare workers are really called into battle against COVID-19. You almost had to run in the opposite direction of what everyone else was doing with your missions to guide you. And so I would just like to take a brief pause here and say thank you, as well as encourage everyone on this call and everyone watching this video to extend thank yous to their fellow healthcare workers, as well as receive the thank yous in these next couple of moments. Thank you. When we're looking specifically at behavioral health concerns in healthcare professionals, the first thing we have to notice is that we are in a time where we're all experiencing a collective trauma. So healthcare workers are experiencing the COVID-19 trauma alongside the people that they serve. So as we outlined on the previous slide, all of the previous stressors, there are other stressors that come along with being a healthcare worker. Yet again, we're having long work shifts and trying to figure out how best to do our work-life integration. Across the population, you may be seeing more flexibility in other job fields that may not be afforded to the healthcare workers. We have limited resources. And when we are able to get appropriate PPE, we have additional physical discomfort around that. Since we had to jump in and really kind of fly the plane as we're building it, feeling unprepared and having changing protocols is already adding to the already chaotic virus. Excuse me. From consistent contact with COVID-19, excuse me, we can see that there might be an increased fear of spreading the disease to our family, friends, and colleagues. We also, because of this fear, may have to change our routine and narrow our social support during this time. As I'm giving a presentation on COVID-19, I'm attacked with coughing, so I apologize about that. Not only do we witness trauma in our own work, but also hearing the trauma stories of our patients that we may bring home. Additionally, there may be a stigma attached to healthcare workers, right? People may not want to go in the elevators with healthcare workers for fear of increased exposure. We might feel further isolated. And a way to combat this stigma, the nation had come into this idea of branding healthcare workers as superheroes. But what comes along with being branded as a superhero is the expectation that people won't get sick, that they won't give up, and they don't fail. And so that becomes another thing that a healthcare worker has to place on their shoulders, along with the potential moral injury and making the decisions that are hard to make in everyday healthcare choices. In a 2021 study, they looked at global pool preference across healthcare workers in terms to common behavioral health concerns. So what they did is they looked across 40 different systemic reviews, with over 3 million healthcare workers, and found that there was a pool prevalence of anxiety of 16 to 42%, of depression 14 to 37.2%, of PTSD, stress and distress 18.6 to 56.5%, and of insomnia 9 and 43.7%. Of burnout, they found 25%. What we found in this study also is that physicians and nurses were at a higher risk of developing mental health concerns, as well as other factors that tended to increase the incidence of mental health concerns, such as being earlier in your career, having lack of access to appropriate PPE, being more in close contact with those who had contracted COVID-19, and longer work hours. So if we look across multiple ethical codes that you find in individuals that work in integrated care, you can see that the American Medical Association, the American Psychological Association, the American Nurses Association, and the National Association for Social Workers all outline the importance of taking care of the helper in order to take care of the patients that we serve. And so this doesn't become just a luxury or a nicety, this becomes a necessity when we are healthcare professionals. The other thing I want to bring up in terms of an ethical obligation is often because we are called to take care of others, our self-care is often linked to taking care of others. But I would also like to challenge everyone on the call today, as well as everyone who watches this video, to recognize that your self-care and your wellness is also separate from the care of the patients that you serve. So how do I know? How do I know when the stress of everyday work or the pandemic is getting to me? So what we should know is that stress is expected and we should plan for it in a time of a pandemic. And so if you're feeling more irritated, angry than usual, if you're starting to get maybe even an imposter syndrome, feeling uncertain, nervous, and anxious, feeling like no matter what you do, things are not going to help, feeling helpless and powerless, you don't feel like getting up in the morning, you have less motivation to do things that you used to do, just feeling overly tired or overwhelmed or burnt out, those feelings of sadness consistently stay with you, or you're having trouble sleeping or concentrating, it may be time to seek some intervention around your stress. Some of those individual interventions that are helpful with stress, as well as other mental health concerns, are listed on this page. Just like our physical health, we have to take small steps towards keeping our body healthy. We have to take small steps every day also to keep our mind, our soul, and our spirits healthy as well. And so because stress can be almost isolating, we first have to remind ourselves that we're not alone, and to reach out to those people that are experiencing some of the similar things that you are. So connecting to your coworkers, your supervisors, and employees about the on the job stress. With the pandemic, there's so many things that we can't control. And so identifying those things and instead using your energy on something that you can control and what matters to you. Often when we get in times of increased stress, our mind tends to be very critical of what we're doing or what we could do. And so making sure to step back and give yourself credit, grace, and kindness, realizing that you've been a vital part of fighting this pandemic and that you've been doing the best you can with the resources that are available. Other parts of this is making sure that you have a consistent routine, even if it looks very different than your pre-COVID routine, making sure that there are things in there that are important to you and that can keep you going along in your everyday. Other interventions that an individual can take is number one is definitely self-monitoring. So making sure that you're keeping track and being mindful of how often you're engaging in things that are important to you, things that you enjoy, things that are helpful. Things like exercise and healthy eating, spending fun with just people in your life or by yourself, doing those things that bring you joy, that bring you meaning. When we talk about the 24-hour news cycle, right, that can become all consuming and can also increase the amount of anxiety we feel and the sense of danger that we feel. So taking breaks from watching and reading and listening to news stories or social media that may be talking about the COVID-19 pandemic, stay informed, but also find a good balance for yourself. Taking that time to step back and use mindfulness techniques, may it be breathing exercises, meditations, anything that will bring you back to your body or your mind. And then, of course, if you need it, ask for help and seek treatment. So when do we seek treatment? When it's beyond stress, right? I really want to hit home this idea that increased stress is normal during the pandemic and is to be expected. Someone who is stressed, right, may feel overwhelmed, like they have so much to do. However, they maintain the hope that if they can just get things under control, if they can just cross things off of their to-do list, that things will be okay. Now, burnout is characterized a little differently. This is when someone is completely emotionally, mentally, and physically exhausted and depleted. And so they may feel that no matter what they do, nothing's going to change. So they may have an increased sense of hopelessness and really be disengaged from the work that they're doing or what's important to them. Sometimes burnout will improve with taking breaks or realignment of boundaries. However, someone who is experiencing burnout may also be experiencing a DSM-5 mental health diagnosis, right? And so if your symptoms are impacting different areas of your life, your relationships, your work, your social time, such as, getting written up on the edge of losing your job, not being connected with your family, spending more time in bed, not enjoying the things you used to, seek help. Other things is if you do meet a diagnosis for a DSM-5 disorder, please seek help. And if you've tried some of these individual interventions and they're not helping, it may be time to go to a higher level of care. So when we seek help, we want you to seek evidence-based interventions. Another way to say this is treatments that work. So for anxiety disorders, treatments that have been proven to be evidence-based are cognitive behavioral treatments and acceptance-based treatments. Those that are helpful for depression are behavioral activation, cognitive behavioral treatments, and acceptance-based treatments. Those that are helpful for PTSD are cognitive processing therapy, prolonged exposure, and cognitive behavioral treatments. And those for insomnia are cognitive behavioral treatments for insomnia, as well as brief behavioral treatments for insomnia. Where do you get help? So I am a behavioral health consultant and I'm embedded in an integrated primary care system. And so you can go to your own primary care providers and they may have a BHC or behavioral health consultant in there and that can come in and do on-the-spot intervention. If not, often primary care providers will have referrals in the community that they might be able to point you towards. Other things that you can always do is to contact your health insurance to get a list of in-network providers or seek your employee assistance programs. An important thing to mention is when you are seeking a community-based provider, making sure that they have experience with healthcare workers and some expertise. Because as outlined earlier in the presentation, yes, we face similar stressors as the general population, but we also face situations that are unique to being in the healthcare field. So how can your organizations help your employees? The first thing we have to do, as well as other situations, is we have to bring in awareness and recognize that we are in an instance of collective trauma, that our employees are suffering alongside our patients. And so including the helper in your mission statement, including them in making sure that they are well as well, making sure that their psychosocial health is just as important as their physical safety. And doing this by creating psychologically safe and trauma-informed environments. In order to kind of help with that uncertainty around the pandemic, giving time to provide brief and regular updates on challenges that might be coming in your current organization and how you're addressing them. It's also important to promote peer consultation, to promote peer support, giving people time and safety and being able to talk to those around them. Also giving them regular forums to speak up and ask questions about their concerns, not only in the big meetings, because not everyone is comfortable in speaking up in a big meeting, but maybe even a lot in electronic forums or in one-on-ones. It's important to make sure that your employees know about employee assistance programs and other forms of things that are available to them in order to help with potential psychosocial needs, along with other concerns. One thing I wanted to do is just provide some online resources. Mental Health of America has a beautiful website that's particularly for healthcare workers or frontline care workers that you can go to and screen yourself for a variety of mental health concerns, and they can give you resources on the spot. They also have things for what you might encounter in the work. So like setting boundaries as a primary care provider, sleep deprivation, addressing vaccination anxieties that may help the day-to-day in encountering in our office appointments. The American Medical Association also has lots of nice resources such as a provider self-care toolkit, or even information about how to help family members that have healthcare workers continuously exposed to COVID-19. All of us who have smartphones, we're always looking for something to have in our pocket that we can pull out and might be able to guide us in some of these interventions. And so I wanted to provide you all a list of research-informed apps based on what you might be looking for. So for overall mood fit is a good app. For meditation, you might be looking at Headspace. For stress, iBreathe, anxiety, Mindshift, Sleep CBT iCoach, and just a mood boost, Happify. So these are my references, and I would just like to thank you for allowing me to talk with you today. And I hope that something has struck home and given you some quick tips and simple things to implement in your everyday life. Another thing that I just wanted to mention is I know that some of the stressors about what we can do for our patients come up. And so these are two books that I really recommend if you're interested in learning some interventions to do in your own clinical work, so Motivational Interviewing in Healthcare, as well as The Real Behavior Change in Primary Care. The Real Behavioral Change in Primary Care talks about how you might be able to help your patients, but it also has a really good chapter on how to prevent burnout, as well as increase job satisfaction as a primary care provider. So I will stop sharing here.
Thank you. Thank you very much, Dr. Houston. Is there any question from our audience? This is a very informative presentation. And as you mentioned, thank you for all the community health workers work. Thanks, a big thanks. Thank you so much for that comment. Is there any question from it was a one question, Dr. Rosenfeld, and previously it says many of the evidence-based intervention you described seems to require special training. Trained professional with a license or certification. Are there any evidence-based intervention where is a PCP or community health worker who can administer or provide this intervention, Dr. Houston? I wonder if you can give us some words in this.
Yes. So as I said before, I'm a behavioral health consultant. And in the primary care behavioral health model in which I work in, one of the reasons why a behavioral health consultant is embedded in the clinic is not only to provide service for their patients, but also to upskill everyone on the team, including nurses, primary care providers, community health workers, and so increasing our likelihood to be able to not only reach the populations that the BHCs see, but also primary care providers and nurses, right? They're all going to see more people than the behavioral health consultant is. So things like behavioral activation, I believe, has been implemented with community healthcare workers. As I mentioned before, that book on real behavioral change, that talks about how primary care providers can bring in acceptance and commitment treatments into their own visits, as well as many providers are trained on motivational interviewing. And so I think that healthcare in general is moving towards basically the team being able to do some of these interventions, and there's multiple trainings out there. The other thing that I want to mention as well, and I mentioned this earlier, is often when we're talking about the health of healthcare workers, we often bring up the health of our patients. And so just to be mindful that your own health is important as well, and our mind can tend to drift away from that and say, how can we take care of our patients?
Yeah.
Can I also offer just one resource that I know can be really valuable is the peer support specialists. It's a growing workforce that is akin to community health workers, specifically trained to work with community members and really anybody as peer educators, peer support for folks suffering from poor mental health as well as addiction recovery. So the SA Clubhouse here locally is a leader nationally in training and providing peer support specialists. So that's another resource folks should be aware of.
Thank you. Thank you very much. So now I would like to go ahead and give this space to Dr. Higgins, who is presenting the first case. On your time, Dr. Higgins.
Hi, everyone, and thank you so much for your presentation, Dr. Houston. I didn't really like feeling called out about panic buying and hygiene theater, but you know, okay, that's a thing that happened. I'm trying to learn from it, but I appreciated that a lot. So I'm currently working at the city of San Antonio as the chief mental health officer, but in 2020, 2021, and then the earlier part of this year, I was running a mental health facility for the local mental health authority here in San Antonio. And it was a 24-hour facility. And the whole point of our programming was to take people from the hospital who are ready to discharge from a mental health hospitalization, but maybe not, you know, maybe didn't have a placement yet or needed to be plugged into services. And so we really made it our mission to take people no matter what. And we had a few people that we took that were COVID positive, and we had a good plan. We had isolation rooms and we had protocols and procedures, and, you know, asymptomatic COVID positive folks we were taking, and that was okay. But what really got us in a bind was in August of 2021, when that Delta variant, I feel like everything's Omicron nowadays, or there's new stuff too, but the first variant that I was really aware of was the Delta variant. And somewhat ironically, I was the first one to come down with it. And it was funny because I had been at work for a few days with a sinus infection, and we were wearing masks. We were very, very good and socially distanced and very aware. And I thought I had the sinus infection, and I didn't have any of the coughing, shortness of breath, loss of taste or smell, fever. And I think I even Googled sneezing, COVID, Delta, and the internet was like, nah, you're fine. And I was like, okay. And so I went to this fancy brunch party, and they were testing at the door, and I came back positive and I had to leave. And so talking about like the stigma of feeling like this very aware and intentional healthcare provider, and then getting caught was kind of, funny and embarrassing. And I had to go and, start contacting people at work. And so while I was at home on my like quarantine, people at the unit called me about 5 days later. And so probably not related to me, but called me and said that there was some headaches, some sneezing. And I said, you know what, our screener that we had definitely had those symptoms on it, but we had sort of been ignoring those more like generic symptoms in favor of very clear COVID symptoms, the loss of taste and smell, the fever, the dry cough, the shortness of breath. And so I said, you know what, I'm going to take my lesson learned, and the CDC is saying new things. And if anyone pops positive on anything in the screener, staff or client, then they need to be tested. And so we ended up having several people have some sneezing and headaches and things like that. We tested everyone, and 2 of the 6 staff that were working, and I think 3 of the 11 patients that were there were positive. And this is all on a Saturday. And so there was initial feelings of panic and, oh gosh, and what are we doing? And we just had to quickly move through that and move into those good protocols that we had. But those protocols were built around knowing that someone, a client would be positive, and assuming that a workforce member wouldn't come into work feeling with any of the symptoms that we had, committed to memory. And so it was difficult in those moments, and it felt hard. And I know the staff who came out positive were feeling like, where did I get this? Did I get this here? Did I bring it here? And you're trying to reassure a residential facility full of people that everything's going to be okay, when in fact you really don't know. And it really was a lot. You have a lot of responsibility. And so the way that, we handled it was we just had to kind of kick it into work mode. But then we had to, do the circling back and rounding with all of the clients, making sure that we're super attentive and acutely aware of how they're feeling physically. But then because, anyone was feeling a certain heightened level of anxiety at that time, but, we're working specifically with behavioral health patients. And so being acutely aware of their mental health symptoms, and if they're exacerbated or anything like that. And so I think because we had plans in place, we were able to handle the situation, but it was definitely a feeling of we had been so focused on like what original COVID was like the March 2020 sort of variety, that we weren't paying as much attention to the changes. And so another lesson of like, okay, you can't, instead of letting the news and the research sort of get to you, you've got to watch the news and watch the research so that you do have that most up-to-date information, and you do have the best information that's out there, and letting that quiet and comfort your anxiety instead of feed into your anxiety, and trying to look at it in that perspective. So that's what I've got.
Yeah, Jesse, I appreciate the case, and I'm kind of thinking here for the learning community here, we have an ever evolving pandemic, right? We want to be done, we're not done. What's the best way? And this is a question for the entire community. We can start with panelists, or if anybody has a thought, what's the best way for us to continue to keep our teams aware of the ever evolving information without contributing to the stress that Dr. Houston mentioned with the information overload and the 24-hour news cycles. Has anybody come up with a strategy for engaging with their teams or with their supervisors to keep that awareness level high without ideally inducing more stress and anxiety?
I think it was hard to, I think we have to be really intentional, and when are we going to talk about COVID and COVID updates and who's going to bring them to the team? I think that daily briefings, which were really important, like at the beginning, these, we were on these daily conference calls every day at 7, kind of talking through the numbers of Bexar County. And then, but then that kind of just, that it became a little bit blasé because it's like hasn't changed or is changing so much. And so I think who the designated informant is important, that they're trusted and that they're giving clear updates, and that you're getting them maybe in a verbal, like a staff meeting weekly or whatever, not just emails that people are maybe not reading. Not that anyone ever does that, but that I think it's a clear line of who it's coming from and when you're getting it, and so when to pay attention.
I would echo that. Definitely making a time and making it consistent. And I think one of the ways to do that is not only, like you were saying, not only talking about what's going on, but what you're doing to address it, and making sure that, there's adequate training and times for questions. So that it's not just, oh, this is dangerous or this is scary, but this is what we're doing to keep you safe as well. This is how we're keeping our employees safe. This is how we're keeping our patients safe. And then also, we were all called to this field because it's important to us, right? There's a value in it. And just like acceptance-based treatments, people will go through a lot of stuff if it's important to them. And so bringing it back to why we're doing this, why it's important to us, can kind of mitigate some of that stress that they may be feeling.
Thank you. Thank you very much, Dr. Houston. As you mentioned, very important, the training and to keep the patients and staff, but very important. And Dr. Higgins mentioned the plan in place that help them to go through that. Today we have a second case, Dr. Prasad, presenting a case today. Thank you.
Can you hear me? Yes. Yeah, just before I go to the case, there was a question in the chat, and that's a very important aspect to talk about. Last 2 years or so, we have seen a surge in number of people seeking support, mental health support, and we have been trying to place them to outside resources, counselors, and psychologists. It is hard. You can't get appointments for more than sometimes 6 weeks, 4 weeks. And especially Dr. Houston, when you talked about having some knowledge about healthcare, is almost very difficult. So in those cases, I wonder whether, community health, we talked about some resources, and I know in some hospitals, they're providing like a whole group therapy kind of things. So this is something we are facing on a regular basis, connecting people to resources. Any ideas there would be even in chat, or any of you, Dr. Houston, you could send me an email. I would really appreciate that. And same, any other people who are attending.
I put some resources in the chat. I'm not sure. I know people are from different places. I'll copy and paste them here again.
Sure, please. Thank you. Yeah. So, okay, great. So the case that I was intrigued was, I had heard about these, some COVID. I don't know whether it's induced mania, but after they have contracted COVID. And this was a case fairly young and non-health professional, but still involved in the healthcare, and contracted COVID, and exactly didn't think 10 or 11 days after that, having this hypomania, mania side kind of symptoms, has not had any problems before. And they used to be my client some time ago for various other family related issues, but nothing. And then because I knew the history, I took a careful history of what are all the things that were going in this case, and literally made a chart of all different domains of their lives, how things are going and what were all the stresses and everything. And then they had gone to a PCP, but probably not exactly talked about their case history. So they were given a medication that only really didn't help. It made it kind of worse. And then I was able to recognize that because I knew the background, and I was able to connect them with the right support. And it took, the whole thing took about 6 weeks or so. And then we made a conscious effort of lifestyle changes, stress response, family support. And this is coming from a different cultural background. The family was very, very interested to know. They wanted to know all the details. So there is a line that you have to cross. You cannot cross saying that you want to tell them everything that's happening. So we were very discreet about talking about what they need to know how to support. And I mean, fortunately, most of the medications are off, and then just right now, supportive therapy and just supportive medication. And I had mentioned before, but there was one thing that did intrigue me, but I'm not an MD, neither a nutritionist. They were very interested in bodybuilding, so they were taking some creatine. So there are some studies I looked up, and it can kind of increase the mania. I don't know, that was one of the things, but the point is to take a whole history. Many physicians are working hard, even us psychologists, counselors, we don't have so much time. So this is a real concern. So just to pay attention to the whole domain in order for them to help. But the long story is they are doing well. And after that, I've been noticing there are quite a few cases that's coming up. And I don't know, in our own university health expert, the expert on long COVID, Dr. Gutierrez, she may have come across some cases that I don't know about this. And just to say, this may happen, I mean, I saw in a client, but this may have happened to our colleagues or someone or anyone else. How would you recognize, and how would you approach them? Have a conversation to say, hey, is everything okay? How can we support you? That's the real issue in this.
Yeah, maybe if I could ask a question to the group here. So we've unpacked a lot of different things within this session around the stressors on mental well-being, and even had a case about somebody having a potential mental health crisis. So my question for this group is, are our employers, are our supervisors, leaders talking about mental wellness within our teams? Is this even being discussed? And if it's so, how successful is it? So are these conversations that are happening on the teams that you work with? And this is a question to anybody in the community that would like to share.
Well, I can speak to that. We provide workshops, talks to residents and fellows, and to say how to recognize symptoms and how to approach us and what can we do. And then we really tried our best to provide a psychologically safe space. And I am sure other things are happening, but I would be very interested to know.
Dr. Monica Verduzco has a comment in the chat. Did you want to elaborate a little bit more?
Oh, it's just answering the question, just saying that, yes, I've seen some patients who otherwise didn't have a psychiatric history or really controlled psychiatric disease after COVID, just because some of the inflammation and the inflammation crossing, blood-brain barrier and such, have mania, have to be hospitalized for a psychiatric condition, suicidal ideations that were very, very severe after COVID. And then there is a large study in Lancet Psychiatry that's showing that, yes, we're seeing this afterwards also, but a lot of times the like anxiety, depression, the psychiatric conditions decrease within a couple of months and get better. But definitely the initial is bad.
Is there another comment that we would like to share in regards to the doctor?
I wanted to make a comment. This is not really earlier Jason's question. I had a discussion with a friend of ours who is an attorney for another company, and they are having a hard time to recognize what's the long-term COVID effect and how to say they really need long-term support and things like that. So this is a real issue even among employers, whether they're healthcare workers or anyone else. This is something that I'm sure needs to be addressed in the long term for many years to come.
And Dr. Romero, go ahead.
I'd like to just answer your question too, that about how do we approach healthcare workers. It's really about what you do before, right? Setting up those psychologically safe environments, including it in your monthly check-ins and your talking, encouraging people to talk about their lives, know each other as people, not just employees. Because that's when someone will feel safe or will be receptive to help.
Yeah, and I just wanted to quickly follow on that, Dr. Houston, just to kind of put a bow on the conversation and bring it back to the health literacy principles that we've been discussing throughout this series. Creating that safe space is such an essential part of any health communications program, whether it's within the healthcare workforce in the community, making people feel seen and heard and that their perspectives are valid and real. And so it requires that active listening. It requires that pure curiosity and not just a pro forma to have a conversation, and then making sure that we acknowledge perspectives, even though we may not have lived through a mental health crisis ourselves. We have to understand that others may have, and that we need to recognize that as a valid way of experiencing life. And so it's hard for us because the work environments create additional stressors and time pressures. But to your point, we have to, as supervisors and as colleagues, make space for this and make it less stigmatized to talk about. So I just wanted to kind of bring us back to these core principles that we've been talking about so much. And while I still have the talking stick, I'll just say thank you to our presenter, Dr. Houston, and to our panelists, and then I'll hand it back over to Dr. Romero.
Thank you so much, Dr. Rosenfeld, to close in such a very good way and remark and remind us the points of the communication and the health literacy principles. Thank you so much. Thank you, Dr. Higgins, for the case, Dr. Prasad for the case, Dr. Houston for the didactics. It was such a wonderful learning opportunity. Thank you all for being with us today. The activity code is 100923448, and that is in the chat, as well as the link for claiming those credits for continuing medical education, the CNED, and the ethics continuing medical education. Next session is going to be Friday, December the 9th. It's going to be at the same time. Thank you so much. You have a wonderful rest of the day. Thank you all for being with us today. Thank you.